Hello everyone, welcome to StandUp. The fifth wave of the COVID-19 pandemic in Hong Kong is now out of control, with the highest daily numbers of new cases since the pandemic began. The government announced that aside from staff providing emergency and essential public services, as well as those who involved in anti-epidemic efforts, all government employees will continue to work from home. Chief Executive Carrie Lam announced that the government will further tighten the social distancing measures in view of the COVID-19 epidemic situation. The maximum number of people permitted for group gatherings in public places will be lowered from 4 to 2. The government will, for the first time, also impose restrictions on group gatherings in private premises by limiting multi-household gatherings in private premises to 2 families. Liang Wannian, an official with the National Health Commission and head of a panel of experts advising the government on its coronavirus response, stated in a recent interview that Hong Kong must continue the dynamic zero-infection strategy and never tread the wrong path of living with COVID-19. The Hong Kong government has adopted a series of anti-epidemic measures, including social gathering limits, restriction testing, and compulsory testing, all are defensive strategies. Liang noted that the priority is to expand nucleic acid testing, which will identify asymptomatic carriers as soon as possible to cut off transmission chains and contain the spread of the virus. Despite this knowledge, the government rejects universal screening. Carrie Lam has brushed it off as too difficult and ineffective, despite mounting calls from the public. Since then, the pandemic situation has spiraled downward to where it is today. Record highs in daily new cases have proven that compulsory testing measures have virtually no defense against the Omicron variant. Under great strain, medical staff struggle with putting out the fires and verge on burnout. As the head of the National Health Commission's COVID-19 leading task force, Liang's suggestion shows Beijing's concern for the outbreak in Hong Kong. In fact, Hong Kong is well equipped for universal testing. For a start, the Huoyan laboratory, when re-established, will ramp up the city's testing capacity by 100,000 per day. Second, backup personnel from Guangdong province has been signed, ready to boost Hong Kong's daily testing capacity. Third, now that Liang has proposed expanding nucleic acid testing, the National Health Commission is expected to reinforce Hong Kong with medical terms and supplies to cover this need. Objectively, Hong Kong is well positioned for citywide COVID-19 testing. Subjectively, residents have had enough of the pandemic after a 2-year battle. Many people have experienced first-hand restriction testing and compulsory testing during the fifth wave, which is more severe than ever before and shows no sign of waning. Thus, universal testing endorsed by the National Health Commission experts promises to win most people's understanding and support. Okay, that's all for today. Thanks for watching. Please subscribe to our YouTube channel, Worm Talking and Orange News. See you next time.